I admit that managing thyroid medication can be confusing, so it shouldn't be shocking that some thyroid patients experience almost too good to be true symptoms when they start or stop taking their medication. One such example is people who lose weight when they stop taking levothyroxine instead of starting it. While this may sound impossible, it does happen occasionally and isn't always common. It happens frequently enough to be worth talking about. After all, the more knowledgeable you are about thyroid medication, the more likely you are to feel 100% again. It is what every person with a thyroid wants. Understanding how thyroid medication affects weight generally is necessary to understand why some thyroid patients lose weight when they stop taking levothyroxine. This is not as simple as most people think it is, as most thyroid medications have little to no effect on fat mass, but can have a significant impact on fluid retention in the body because they affect compounds like glycosaminoglycans, which cause the body to retain water. Your body stores these substances in your tissues when you have a low thyroid state, and they carry water with them. Therefore, any nearly instantaneous change in a thyroid patient's weight when they start or stop taking thyroid medication is almost always related to fluid, not fat. Yes, thyroid medications can also cause fat loss, but this effect is small and usually occurs over a longer period of time. In fact, most hypothyroid patients who start taking levothyroxine will experience a weight loss of approximately 10 to 15 pounds, if any at all. But back to the original question, why do some people lose weight when they stop taking thyroid medication? While the exact cause is unknown, it is likely related to these two factors. First, and perhaps most commonly, they were taking levothyroxine when they didn't need to. According to the most recent studies, up to 1/3 of thyroid patients using levothyroxine or thyroid medicine in general don't need to be on it. This information may come as a shock because it obviously contradicts the advice that many of you received when you first started taking your thyroid medication. You were likely informed at that time that you would need to take the prescription for the rest of your life. Although studies like these support this, it is true that if you are taking levothyroxine and you don't really need to be, you will likely feel better once you stop taking it, and you might lose a little extra weight in the process. I know this may seem counterintuitive because taking extra thyroid hormone shouldn't lead to more weight loss rather than gain. But the reason for this is because levothyroxine and most other thyroid medications contain different types of thyroid hormones. The thyroid hormone T4, commonly referred to as thyroxine, is 100% present in thyroxine. This is significant in the healthy state because T3 is the most potent thyroid hormone, and taking levothyroxine inhibits your body's ability to naturally produce T4. It follows that thyroid patients on thyroxine are obviously not receiving a healthy ratio of T4 to T3. Your body produces approximately 80% T4 and 20% T3. If you were taking levothyroxine when you didn't need to, it's possible that your body will be able to manufacture more T3 after you stop taking it than it was able to produce while you were taking levothyroxine. In other words, the more T3 you have, the better you'll feel after that. The relationship between a higher T3 level and increased thyroid function in the body, fluid excretion from the body, and weight reduction is easily understood. The second cause, albeit less frequent, is nonetheless there. The levothyroxine dosage that was administered was excessive. It is much more typical for thyroid patients to take too little thyroid medication, that is, an underdose, than to take too much. But many people, possibly many of you listening to this, take more thyroid medication than is necessary. Now, according to some studies, roughly 18% of patients taking levothyroxine or thyroid medication take more than they need at any given time. When this occurs, it's easy to see how taking too much thyroid hormone can lead to a situation in which you might not feel well and that your body will be out of balance. It follows that stopping the thyroid medication would likely cause you to feel better. This makes sense. But how does it square with the fact that taking too much thyroid hormone is typically associated with weight loss rather than weight gain? Not exactly. The reason is that As I previously mentioned, the majority of thyroid patients taking levothyroxine are giving their bodies too much of the inactive thyroid hormone known as T4. This excess thyroid hormone can turn off TSH production in the brain, giving the impression that the patient is hyperthyroid. However, the tissues in the patient's body will try to compensate by converting the excess thyroid hormone into an inactive thyroid hormone metabolite called reverse T3, and states of excess reverse T3 result in hypothyroid symptoms. They do this because they obstruct thyroid activity, which explains why many thyroid patients have low TSH levels but nevertheless suffer low thyroid symptoms. This condition is known as tissue-level hypothyroidism. In the event that levothyroxine is being converted by your body into the thyroid-blocking hormone reverse T3, you will feel better once you stop taking the levothyroxine because your body will be able to produce T3 again. Ironically, stopping thyroid medication will actually improve thyroid function because of this conversion process. By the way, if this is your first exposure to thyroid conversion, be sure to watch my other videos, as they go into much greater detail regarding thyroid problems. Now, if you're looking to lose weight, does this mean you should stop taking levothyroxine? The short answer is no, because levothyroxine has a long half-life. Even while it's normal for some people to see an improvement in their symptoms after they stop taking it, many of those same people will wind up back in their hypothyroid state within a few months. Since levothyroxine stays in your system for about 30 to 35 days, even if you stop taking it today, you would still benefit from the levothyroxine you took yesterday for about a month. However, since about 1/3 of you are taking thyroid medication when you shouldn't be, it's definitely worth talking to your doctor about whether or not it's worth trying to stop taking thyroid medication. If you're interested, check out my previous videos on my channel, where I walk you through the exact process of stopping your thyroid medication. But be advised that not everyone can stop taking thyroid medication. This is especially true if they have had their thyroid removed, have had radioactive iodine ablation, or have end-stage Hashimoto's disease. However, for patients who do not fall into any of those categories, it is definitely something worth looking into. Remember that there are still plenty of things you can do to improve your health, even if you must take thyroid medication for the rest of your life. As we wrap up our discussion on weight loss after stopping levothyroxine, it's important to remember that everyone's journey is unique. Transitioning off levothyroxine can bring about a range of changes in your body, and weight fluctuations are just one aspect of this complex process. Patience and persistence are key, and it's crucial to give your body the time it needs to adjust. Implementing a balanced diet rich in nutrients, staying active with regular exercise, and maintaining a healthy sleep schedule can significantly aid in achieving your weight loss goals. Furthermore, don't be afraid to ask medical specialists for assistance. We hope this video has provided valuable insights and helpful tips for those navigating the challenges of weight management after stopping levothyroxine. Our first objectives are your health and well-being, and we're here to help you every step of the way. Please give this video a thumbs up if you thought it was helpful and informative. It really helps us to know that we're providing the content you need. Don't forget to share this video with anyone who might benefit from it, whether they're facing similar challenges or simply looking to expand their knowledge on thyroid health. Your support helps us reach more people who could use this information. And most importantly, if you haven't already, please subscribe to Health Angel Solutions for more content on health, wellness, and living your best life. By subscribing, you'll be the first to know when we release new videos filled with expert advice and practical tips to help you thrive. Hit the notification bell so you never miss an update. Thank you for watching, and remember, your health journey is a personal one. Stay informed, stay proactive, and stay healthy. Until next time, take care and be well.